Good day, everyone, and welcome to 2023 and a new set of editions of DocTalk. It is our opportunity to talk about the health issues of the day, and today I'm doing it from a very interesting site. This is the CES show in Las Vegas, Nevada. CES was the Consumer Electronics Show, which is now just CES because the reach of this show is so broad. And I'm actually in the health arena, which is one of the entire halls here, filled with implementations of technology that improve health. And the intent is to keep people healthy, to avoid their use of emergency services, and to allow what they do in their day-to-day lives to stay healthy, to really be integrated with everything that they do. What great ideas. Incredible things that companies are working on here. And of course, I'm right next to a booth which has Moderna in it, which is still working very hard to put an end to COVID or to interact with COVID for the rest of our lives, which is what it looks like we're going to be doing now. So welcome to 2023. We are on a number of right trends, and that's what we'll talk about today, on the good side of what is happening in healthcare and with infectious diseases. So first to report is RSV, which is the very bad respiratory virus in kids, is decreasing in incidence really now across the country. There may still be a few pockets where RSV is impacting kids, but let me be very honest. We have had so much RSV go out into communities over the last 4 to 5 months that there aren't a whole lot of kids that are at risk, that are still at risk for it. And RSV has been typically a one and done infection for kids. They get it one time and they don't get it again. Second is the flu. Influenza A, particularly the H3N2 strain, has been circulating at a very high rate and impacting a lot of people, with thousands of hospitalizations a day related to the flu. What really has happened that is good is we had this massive cold outbreak that kept people at home for 2 or 3 or 5 days, depending on where you were in the country. There's another storm moving through the country now, not as impactful in terms of keeping people away from each other. Nonetheless, any of those weather outbreaks that reduce people's interaction with each other dramatically reduce the number of infectious diseases that get spread. There are many winters that occur where we have a cold snap. It keeps everybody home for 2 or 3 days. And all of a sudden you see a dramatic decrease in whatever infectious disease was going around before it. And that's in effect what has happened with the flu. When you have people that are sick, that don't have anybody to interact with that are susceptible, you kind of break the succession of the infection for other people. And so it appears that we have had that kind of influence of the major cold outbreak, which is one of the very positive things that can happen from one of those terrible winter events, which did impact a lot of people in a negative way and killed people, and it's very unfortunate. All right, our third infectious disease we're concerned about now is COVID. And COVID has a new variant that is spreading. For those of you interested, XBB 1.5 is the current variant that is moving across the country. At this point, it's moving kind of east to west. But what we have found about XBB 1.5 is, although infectious, it does not seem to be producing high levels of hospitalizations and deaths. That would be a good thing. A few more people that have at risk for COVID that have had an illness related to it, that improves our overall population health by that not having those people be at risk for future COVID infections, at least the current variants that we have. What is a risk we have to talk about today is what's going on in China, where they have had really their first major outbreak of COVID amongst a wide population. Remember, their population numbers more than 1 billion. The first 3 years of spread of COVID have not impacted their population at a high level. and so many people were at risk. Their vaccination program's not as strong as here, and their vaccine may not have been as effective. And so now we have large volumes of illness with COVID in China. That impacts some of what happens with products that we get here that are manufactured in China. But number two, when you have that many people getting sick, there is a risk that new variants and potentially new deadly variants will come out of that pool of people in China that are getting sick. So that's something to be watchful for. And our public health people across the globe can't be any more concerned and surveying what's going on in China. We've also heard that Chinese travel is being restricted in other countries with the expectation that people will get checked before they go into other countries so that they're not carrying future variants into other countries across the globe. We're in January, and this typically would be our highest time of the year in terms of infectious diseases. Typically, volumes go down a little bit February and March, and that would be a very good thing if that continues to happen now, because we appear to be on the downslopes of our three bad respiratory infections that have impacted the American population and the North American population this winter. We don't see anything else on the horizon, but I'm going to make you aware as we go into the spring and into the summer, we'll be mindful of COVID. We will be thinking about how we modify vaccines moving into the fall. And work will be done and headlines will be made about COVID vaccination into the fall of 2023, whether it will be added to the seasonal influenza vaccines, whether that's an effective way to do it, whether we could make it into a product that we would spray in our noses or swallow. That's always something that has been desirable and we've talked about for 3 years now in dealing with this. So looking at COVID vaccines and what are the potential uses of vaccines into the fall will be important for everyone. What it also appears now is that masks are still good. And here I am at a big meeting and I took it off for this, but here is still the mask. This is still not something to get rid of. And keep in mind when you're in big settings where other people are ill and where you don't want to get ill, this is still good protection for you. And what we have used for years in the surgical suites to keep the surgeons and other people from getting ill. You don't have to have the big heavy N95 mask necessarily on. When you're in the public and you're at risk, you may consider still the use of a mask, which I am doing right here in this environment. Please, as we go through the winter, we have cold weather, we have carbon monoxide, we have ice and slips and falls and all kinds of things that put our population at risk in the wintertime. Please take advantage of the opportunity to protect yourself, your family, and others. We've had several big CO incidents across the country where people were exposed to products of combustion, which include carbon monoxide from blocked heater ducts from the cold and from snow drifts that come up over the exhaust vents and other things. If your family, a number of you are getting sick, you should have CO alarm in your house and listen for that to go off. If you don't, there's a lot of really good CO alarms to put in your house and to protect you and your family and your workplace. And some people even use them in hotels, in their hotel room. They'll take a CO detector with them, make sure they protect themselves. I want to talk about CO during the winter time because that's a completely preventable illness and death that can occur to people. And then obviously anything you're doing to heat your home, if your power goes out, it even gets more pressing to heat your home. Please be safe in how you do that and make sure, number one, it doesn't set fire to things around it that you're using to heat. And number two, that it isn't producing products of combustion that can harm you and others. So wintertime's here. We've had a downslope in the incidence of our infectious diseases. That's good news. We still have to be mindful, protective, still watch for headlines and things that we're worried about. This is DocTalk. It's January. Get through the winter. I look forward to a very good year in communicating with all you and a good year for public health in 2023. Take care of yourself and the people around you. Thanks.